Good morning, everyone, and thank you for joining us for a town hall with Lieutenant Governor Garlin Gilchrist. We're going to have a great conversation today. I'm really excited about this. For those of you who are joining us for the first time, you should know that on the right side of your screen, there's an area where you can submit questions for the Lieutenant Governor. And at some point later in this town hall, my colleague Bernard Parker will submit some of those questions to the Lieutenant Governor. I always like to say up front, though, please know we always can't get to all of them, but we'll certainly try our best. Apologize for the late start, and so rather than me talking much more, let's just jump into today's program. And today we're going to talk about as vaccine eligibility continues to expand, so do efforts to alleviate racial disparities in public health outcomes. And ensure that our most vulnerable communities have access. So, Lieutenant Governor Gilchrist, welcome.
Thank you so much for having me back, Tammy.
You're welcome. Just before we start, is everyone healthy in the family and your children doing well?
Thankfully, yes. Everyone's doing well. My wife is doing great. My children are happy and healthy. We've been navigating learning at home, just like a lot of families have in Metro Detroit and across the state. And our baby girl's been an absolute joy. So we're blessed. We're blessed.
I'm happy to hear that. So, Lieutenant Governor, you were one of the first to really sound the alarm regarding racial disparities for healthcare in COVID. And of course, you did that in the very early stages of the pandemic, which helped lead to the Michigan Coronavirus Task Force on Racial Disparities. So it's about a year later now. How are we doing overall in achieving equitable outcomes?
Well, Tammy, this is a super important issue in this pandemic, but also when it comes to understanding health outcomes overall. And really, this has been a tremendous team effort in the state of Michigan. And, I really want to start with the gratitude being pointed towards our chief medical executive, Dr. Jonae Caldoun, and Governor Whitmer for frankly having the courage to be the only governor in the country to be unapologetic and clear about these racial disparities very early, and by creating the Michigan Coronavirus Task Force on Racial Disparities via executive order in April of last year and asking me to be the chair. And we are only able to even take that action because we, our collective, our state health department, our agencies, our community partners, hospital partners, we made the choice to actually instrument our public health infrastructure to measure and track and report data on demographics when it came to COVID-19 tests and fatalities that included race and ethnicity. And what we saw is that there was a dangerous and deadly disparity. Black Michiganders, for example, make up less than 14% of the population in Michigan, but we accounted for 41% of the cases in the first 2 months of the pandemic. And so that was urgent, and we needed to act on that quickly because we needed to save lives and stop people from getting sick. And so we took action as a task force, and it wasn't a regular task force. Y'all have all heard about task forces and blue ribbon commissions that do research, and they get a lot of smart people and present very good ideas, but then those ideas wither on the vine. But we needed to take action in real time because people were dying every day. I was getting text messages in my own life of someone getting sick, someone going to the hospital, somebody dying. I've lost 27 people to date from COVID-19. But we have been able to make progress in Michigan because of the collaboration. The task force is made up of business leaders, made up of faith leaders, labor leaders, young professionals, young people, parents, hospital systems, insurance companies, our tribal and indigenous nations, representation from every corner of the state, and strong representation from here in Detroit. Higher education, community colleges, K-12 education, everybody has a seat at this table. And because of that comprehensive collaboration, we've been able to see results. Michigan has been a leader in reducing racial disparities to the point where I talked about Black Michiganders being 41% of the people who died in those first 2 months. We are now down to fewer than 6% of the deaths from COVID-19 over the last 5 months. What that speaks to is the fact that when the state of Michigan chose to focus on the experience of communities of color and on how we can make sure that fewer people are exposed, fewer people get sick, fewer people get hospitalized, fewer people pass away, we were able to actually make progress. And the Biden-Harris administration has seen us as a national model. They have modeled their own COVID equity task force efforts after the Michigan Coronavirus Task Force on Racial Disparities. And Dr. Jonae Caldoun, as the demonstration of that, is a member of the Biden-Harris administration's COVID equity task force.
Right,
So
right.
we've been able to do a lot of things there.
Yeah, I was fortunate to be able to also do a town hall with Dr. Caldoun, and makes us very proud as a state that she is on that national task force with President Biden. So there's been some pushback in the legislature on using the social vulnerability index in deciding how many doses communities receive. Can you talk about the role that plays in equitable vaccine distribution? And perhaps do you have a message to the lawmakers on including social vulnerability? And maybe what we should do is explain to our viewers what the social vulnerability index is first.
Absolutely. So people have seen this term, this phrase used in news reports and things like that a lot in the last year, social vulnerability index. What it is a measure that was created by the CDC. And it is a way to look at different contributing factors to communities of people potentially being more susceptible to negative health outcomes. So it takes into account things like, have to do with your identity, race, ethnicity, average age, median age, gender splits, things like that. But it also takes into account other factors that make up what we call social determinants of health. So things like access to transportation, access to healthy food, access to educational services and resources, things that we have seen. There are decades and decades of research that show that communities that are fighting with persistent poverty tend to have poorer health outcomes. Communities that have less access to doctors tend to have poorer health outcomes. So the social vulnerability index is an attempt to capture all of those in a metric that we can then use to calibrate a public health response so that we can make sure that the people who are most vulnerable or susceptible to negative outcomes can get the support and services and resources that they need. The state of Michigan was a leader early on in actually using this metric, amongst others, to be able to target our COVID-19 response. This is one of the things we used when we targeted where we were going to place things like our neighborhood testing sites that we placed in some of the hardest hit zip codes in the pandemic in the state. We then targeted community anchor institution partners to locate those neighborhood testing sites because we needed to also make sure that people could trust that it was safe to go get a COVID-19 test. And who better to trust than the people who work at the institution that you've had a relationship with for your whole life. And so that same thinking is how we have brought equity to our COVID response. And I just talked about the results. It's how we brought equity to how we distributed the 6 million free masks we distributed. It's how we brought equity to how we distributed the $20+ million in federal resources to 30 community organizations around the state that were focused on the ground grassroots COVID-19 response to address social determinants of health. And so as we turn toward the vaccine, which is our last and most significant hope and tool to be able to end this pandemic in Michigan and around the country, it only makes sense that we use all the tools necessary to protect the most vulnerable people. We have literally seen that work in the state of Michigan, and it has strengthened our overall state response. It is absolutely, ridiculous that the Michigan legislature, legislative Republican leadership chose to argue against the use of this, and I'll tell you why. So the social vulnerability index takes into account a number of factors, like 20 factors. And what we actually see, if you really look at it, is that the social vulnerability index does not just benefit people of color. I think there was a significant, racialized conversation about this, that this was about basically only giving vaccines to Black people. The truth is so far away from that lie. What we've seen is that in some of our counties that are the least diverse from a racial and ethnicity perspective, were some that benefited the most from the social vulnerability index because of the role that poverty plays in access to healthcare services and positive health outcomes. And so what we saw is a lot of Republican members of the Michigan legislature, and I'll speak for the Senate because those are the ones I was, making eye contact with when they were making these ridiculous claims. Those communities and counties that many of those Republican senators represented were the counties that benefited the most from our use of the social vulnerability index. And so I think that their constituents would have a much different opinion about using that as a factor to make sure that adequate vaccines get to people who need them the most. And so in Michigan, we're never going to apologize about putting the experiences and centering the experiences of vulnerable people when it comes to optimizing health outcomes. And frankly, we are going to need to build on that learning, because we need to provide equitable access to economic opportunities, something I know that the members of this chamber care very deeply about. We need to provide equitable access to educational opportunity, something that the members of this chamber have been leaders on for a generation. And so our administration is never going to back away from doing that. And we'll work with anybody who's ready. And then the last piece on this, I'm sorry, it's really important.
It's okay.
The last piece on this is we have one of a few, very, very few, FEMA partnered mass community vaccination sites that's located at Ford Field in Detroit. The reason that the Biden-Harris administration and FEMA selected Detroit and selected Ford Field for this community vaccination site is because we have so aggressively and effectively used tools like the Social Vulnerability Index to deliver public health to people where they are in the community and focus on those who are most vulnerable. And so if we did not have that resource, we literally would not have 6,000 additional doses coming into the state of Michigan to vaccinate people every single day for the next 8 weeks if we had not used those tools made available to us.
So, Lieutenant Governor, I was just at Ford Field this morning at 9 a.m. for my first vaccine.
Excellent.
I have to tell you, I was so impressed at how well run that operation is. So congratulations to all who were involved in that. You talked about equitable vaccine distribution. So in the short term, what do we still need to do to achieve equitable vaccine distribution? So we talk about Ford Field and these large sites. Is there any other examples? I think of New Orleans where they're taking mobile units right into neighborhoods. Are there other ideas that you're going to put forth as far as reaching out into the community?
Yes, so I want to actually focus on those mobile units for a moment, because that is something that was innovated and invented here in the state of Michigan, thanks to the vision of Wayne State University, Access Community Health, and Ford Motor Company partnering to manufacture specially outfitted vans that in the beginning of the pandemic drove testing to communities, a mobile testing unit that could go and deliver tests at churches or jails or parks or homeless shelters or community centers, or just go to a corner in a neighborhood and test everybody on the block. These kinds of innovations happened in Michigan and now have been spread throughout the country. And that's something that we invented here in response to the deep needs that we saw in communities in and around places like the city of Detroit. And so the fact that as part of that Ford Field site, for example, 1,000 of those 6,000 doses will be delivered by a mobile unit to people in community. That is one of the best ways. So all of our survey data has shown that actually people of color would prefer to get vaccinated and prefer to receive services in their community rather than even coming to some place like Ford Field. And that was a really important part of our strategy to deliver testing to communities. It's going to be important part of our strategy to deliver vaccinations to communities. And going forward, it will be part of our public health infrastructure to bring public health to people, because, to quote Dr. Khaldun, the best public health is the public health that meets people where they are. And so we're going to use this again in deeply impacted communities in places like Metro Detroit, but also these mobile testing units have served our migrant farm workers in northern and northwest Lower Peninsula in the state of Michigan, for example. So this infrastructure that we've innovated is really important. And this is how we're going to deal with some of the equity and access challenges, because I know that people have a lot of questions about vaccine hesitancy. And that is something that we need to address. We established a whole commission, the Protect Michigan Commission, literally that exists, the biggest, like most people, most diverse, the most broad commission that we've seated to date to deal with the biggest challenge of any of our lifetimes. And the purpose of that commission, which I'm one of the chairs of, is to make sure people have the information and the resources so they can make the choice to get vaccinated. And what we're actually seeing is there's a little bit more nuance than I think people originally perceived when it comes to this question of hesitancy. For communities of color and for the Black community, yeah, like the Tuskegee experiment happened and it was terrible, and we have people who have don't trust large-scale public health interventions for good reason. But really underneath that, we've seen even more people have questions or have hesitancy because they haven't had adequate and equitable access to the healthcare system overall in the first place. And you don't trust something you can't see or experience. Like that's sort of a natural reaction
Yeah.
to that. So that's why the task force, we recommended and implemented interventions that have made the system more accessible, connecting people to primary care physicians, establishing a health navigator program for connections to health services beyond just COVID-19 test results. We've innovated that to try to solve that access problem. And access breeds trust because relationships breed trust. And so we're going to work on delivering that as well. And then we need to deal with the very real politicization of the question of vaccination. National survey data has been abundantly clear that one of the groups of people that we need to worry about the most are Republican men from getting vaccinated, white Republican men. And so I'd like to see some leadership, frankly, from the Michigan legislature, the Republican leadership in the Michigan legislature, for them to demonstrate, to show that they're getting the vaccine because it's the most important thing we can do for our community, so that our businesses can be open, so that restaurants can entertain people at full capacity, so that high school sports can be carried on safely and not lead to outbreaks that could lead to hospitalizations and deaths and some of the spike that we've seen in recent days and weeks. This is that we all have a role to play to deal with this hesitancy, but we have to be honest about where the hesitancy is truly coming from.
I'm learning a lot today, Lieutenant Governor. Thank you. Let's turn it over to Bernard for a couple of questions from our audience.
LG, how are you, sir?
I'm great. I'm great. Good to see you.
Thank you. I think the last time we saw each other was at Alicia Bell's NOBCO meeting down at the Marriott in
That's
Renaissance.
right. That's right. That's right. That was at the Renaissance, right?
Yes, sir. It was. So just really a couple things folks are saying. One, Mr. Stephen Sherman is saying basically thank you for pioneering the whole mobile health unit, and he says he's seen it work in person, and he thinks it's just firsthand. Another question really from Ms. Burrows. She said she had her first shot. She's looking to go back sometime around April 2nd, but is there really a time frame where folks should look to get the second shot?
Yeah, so it depends on the vaccine that you were given. I think just to say it, like one thing that's very unique, I think, about this vaccination process, among everything's unique about this vaccination process. We've never done anything like this, but people are more aware of like the kind of vaccine or who manufactured it, whatever. And so therefore people are aware that different vaccines have different characteristics. If you got a Pfizer vaccine from your vaccination location, then you need to go get your site. You should have gotten an appointment that's 3 weeks from your first dose to get your second one. If you got a vaccine that was manufactured by Moderna, you'll go back 4 weeks later. If you got a vaccine that was manufactured by Johnson & Johnson, congratulations, you only need one shot. So it differs depending on there. But I do know that when people are getting their vaccines, you're also getting a card that should show when your next appointment is. Hopefully you entered your contact information to the system. You're going to get a text message and a phone call reminding you when your appointments are, because we want to make sure that people get fully vaccinated, not just one dose. Although there's research that's showing that, even one dose is effective, we want everyone to be fully vaccinated so we can get fully back to the things that we miss so much.
Man, I tell you, LG, I feel like I'm back on one of Tommy Stallworth's meetings from last year, racial disparity. You just learn so much in this issue. You guys think. So my last question, and this is a personal question for me, and then I'm gonna turn it back over to Tammy. And this is really, I got this from Lisa Lunsford, who is a co-founder and CEO of Global Strategic Supply Solutions. And so she says this. She says, sticks and stones may break my bones. It's not what you call me, but it's what I answer to, right? We know you to be a politician. You signed your first bill, I think it was 4044. We know you to be an activist. You're out there with the Teamsters all the time, for fair wages and so forth. I know you to be an entrepreneur from the stuff that you did at Microsoft and SharePoint. But who are you, our Lieutenant Governor, Garlin Gilchrist II? Who's the man?
Oh my goodness, I'm Ellen's husband. I'm Garlin III, Emily Grace and Ruby Madeline's father. And I'm someone who believes that I've been blessed to learn a lot of things. My childhood in the city of Detroit and the city of Farmington gave me a very solid foundation. My education as a double engineering major at the University of Michigan. By the way, Michigan's going to win both the women's and the men's tournament this year. Just want y'all to know that. My education at the University of Michigan as an engineer taught me how to be a problem solver, not to fix broken systems. And my work as a community organizer taught me that there was a role for everyone to play to help someone else realize their full power and potential in our society. And so I'm a person who believes that it's my responsibility to try to remind people that they have the power to change their status quo for the better. It's not my job to do it for them. It's my job to, as a public servant, to create the conditions for people to be successful. And I'm going to use every gift that I've been blessed with to do that. And I'm going to be a person who is committed to making that possible for every person in our community in the state of Michigan. I want people to feel like Michigan is the place that moves ideas, and that anybody with an idea can be successful here in our state. And I'm going to work to break down any of the barriers that stand between them and that potential for success. So I'm somebody who's a problem solver and who's trying to create space for other people. And then I'm trying to make sure that I can be a little bit more important to my children, because I'm the least important person in my household right now. So that's what I'm about, Bernard.
Our kids tend to make reality come true for some of us out here.
Oh my gosh, yeah, it's comical how dismissive they can be, but it's great. I love it.
Thank you, man. I really appreciate your time, LG. So I'm gonna turn it back over to Tammy, and I want you to have a blessed day. Okay, sir?
You too, brother.
My man.
So, Lieutenant Governor, one last question for you that I think is really important, because you have been such a leader, and obviously you talked about the team at the state level. We have a lot of work to do before we get beyond this pandemic, obviously, but how do we ensure proper equity measures are in place prior to the next public health crisis?
Yeah, so we need to institutionalize what we've learned. And so, we've tried to put in place some parameters for that through the proposals that we've made. So, for example, in the budget proposal that our administration presented a couple of months ago, we established something called the Race, Equity, Diversity, and Inclusion Office in the Michigan Department of Health and Human Services. That was a direct recommendation of the Racial Disparities Task Force. DHHS is the largest, most complex, and most influential department in state government, and we feel like if we can improve and increase the thinking in this department by having this office, have it be fully funded, have it report directly to the director, we think we can influence a lot of how the state government does its work and interacts and engages with people in the community. We also have through the Racial Disparities Task Force begun to pilot the use of something called an equity impact assessment tool. And basically it's a decision-making framework where when we are making decisions on policy, program, or practice, we can use this equity impact assessment tool, again, developed and delivered to us by members of the Racial Disparities Task Force. We can use this to understand how this will impact different people with different life experiences. And that could lead to making slightly different choices or changing the way we design something to make it be more responsive, more equitable, and lead to a fairer shot at positive outcomes. And so I think with the things like this infrastructure within state government and the piloting of the use of the equity impact assessment tool that one day we hope can be tweaked and be successful enough to be used across state government will really fundamentally change how we approach decision-making and policy-making in Michigan's government. I want to liken it to I think the idea, or sort of my goal, my dream would be that just in the way that data and analytics have truly impacted decision-making across different types of organizations. Data-driven decision-making is now something that a lot of leaders strive for. Well, I think equity-informed decision-making should become a gold standard for organizations as well. And I'd like the state of Michigan's government to be a leader, and we put in place some infrastructure to start us down that path.
There's no question in my mind that you'll accomplish that goal. I know it. I could just keep talking to you about this all day. I just find this so fascinating, and I think it's something we have to make people more aware of. But let me give you the opportunity before we say goodbye, if there's any last words you would like to share.
Well, Tammy, I want to thank you. I want to thank Bernard. I want to thank Sandy and the entire leadership team and the board of the Detroit Regional Chamber. Thank you for hosting this town hall conversation. This is really important. I want to commend the Detroit Regional Chamber for being willing to be, forthright about the fact that we do need to be honest with the racial injustices that are present on a daily basis in our communities, and that we have a role to play in fixing that business leaders in our region, that community leaders in our region have a role to play in addressing that and delivering more equitable experiences for people. That is the first step to actually making change. Just like during the pandemic, Michigan, through Dr. Khaldun, we actually sent a letter to every medical professional in the state that named implicit bias as having potentially negative outcomes on testing and treatment decisions for people of color and Black folks in particular, especially early in the pandemic when we had constrained testing supply. Well, research shows that the first step to actually mitigating the negative impacts of implicit bias is naming it so that you can address it. And so I just appreciate how the regional chamber has really stepped up to try to name these things so that we can begin the process of addressing them. Know that Governor Gretchen Whitmer and I are always going to be available to have conversations with you and your members and the people that you serve about what our priorities are, but more importantly about what your priorities are and how we can work together. We have a lot of work still to do. The pandemic is not over. I need people to continue to be vigilant, to wear your mask. Please wear your mask. Even if you got your vaccine, please wear your mask till everybody gets vaccinated. Like, let's just keep it really simple, because I don't want more people to get sick. I don't want more people to go to the hospital. I don't want people to be exposed. We don't want that. And so we have it within our power to determine how this pandemic ends. And so we're going to work to make sure we get more and more vaccine into the state every week. The Biden-Harris administration has been amazing in partnering with us to deliver on their commitments and exceed their commitments. And you just heard the president yesterday announce a even more ambitious goal than he set in the beginning. And we can get there. We will get there because we can do anything when we stand tall together. So thank you so much, Tammy and the entire chamber, and Bernard for having me here today.
Thank you, Lieutenant Governor. Thank you for your leadership. Thank you for all you do to make our state proud, and your fellow colleagues, Governor Whitmer, of course, and Dr. Khaldun. We are a leader as a state, and that's thanks to the great leadership of all of you.
Thank you. Take
I
care.
hope you have a great day.
All right, y'all too. Bye now.
Bye.